If not extended, important health insurance subsidies, discounts that you could get, maybe qualifying for right now in your health insurance premium, they could expire by the end of the year. What's this mean for you? What are the details? I've got that and more coming up. My name is Mike Bernard. I'm the host of The Wise Money Show. I'm also one of the certified financial planners right here at Korhorn Financial Group. Make sure you hit that subscribe button, turn on notifications, and smash that thumbs up button. All right, the American Rescue Plan Act actually helped create an even better tax situation or financial situation for those individuals, those of you that are getting your health insurance through healthcare.gov, through the exchange, okay? You may remember way back when that the Affordable Care Act put in place that you could get your health insurance through healthcare.gov, and it put in place certain discounts. They're called premium tax credits or premium tax subsidies, if you will, that you can get a discount on the health insurance, on your health insurance premium, if your income's below certain thresholds. And it also depends on how many people are in the family and all that sort of stuff, okay? And these were essentially tax credits that you got, but you got them in advance each and every month because you paid a lower amount for your health insurance than you otherwise would have. And then if your income, by the way, ended up creeping up above those levels when you actually filed your tax return, then all those tax credits, you needed to pay them back on your tax return. It was just wild. We're going to go through an example or two, but it just created a big mess. But ultimately, if your income was below these thresholds, you got a tax credit that allowed you to pay less for your health insurance. Now, fast forward to the pandemic and the American Rescue Plan Act, probably the worst name of any law out there. A Plan Act, I don't know what that is, but this thing was massive. And within it, it put some extra, enhancements to these the current premium tax credits that people got when they would get their insurance through healthcare.gov. Essentially, it moved the cap. Before the American Rescue Plan Act, if your income was above 400% of the federal poverty level, okay, so around $68,000 for a married couple, and if your income was above that 400% of the federal poverty level, you didn't get any of these premium tax credits. There were no subsidies, okay? But enter in the Affordable, not the Affordable Care Act, the American Rescue Plan Act, and it removed that 400% of the federal poverty level threshold, that ceiling. It got rid of it completely, okay? And instead, it enacted, just said, listen, if you're buying your health insurance through healthcare.gov, then if your income is above this 400% of the federal poverty level, still you're going to get a federal tax credit, a premium tax credit, as long as in order to keep the amount that you're paying for health insurance at or below 8.5% of your income. Picture's worth 1,000 words here, especially something so technical, but I'm sort of trying to draw the issue, the problem here before we talk about, okay, what happens. When you take a look at this, under the previous Affordable Care Act, the current law, if you have an income of 400% of the federal poverty level or more, you're not eligible for any premium tax credits, meaning you've got to pay the full price, the full freight for what your health insurance would cost if you're buying it through healthcare.gov. For the past few years, under the American Rescue Plan Act, that ceiling's been lifted. And not only has that ceiling been lifted, but some of the income levels or the tax credits, let's just be direct, the tax credits that you could get have actually been enhanced. So if your income is between 150 and 200% of the federal poverty level, instead of being required to pay up to 4.14 to 6.52% of your income going towards health insurance, it actually was only 0 to 2%, meaning you got a bigger tax credit, meaning you paid less for your health insurance. You following me? Very, very complicated. All right, so why are we talking about this? Unless something is passed to extend these rules by the end of this year, the additional benefits, the additional premium tax credits will expire at the end of 2022, and it will go back starting 1/1 of 23 to the current system and to the current laws. Now, to me, these already have been a benefit to folks, but if you've been one of the individuals that is benefiting more because you fall within these income ranges and your health insurance has been even lower because of these recent laws, you're going to need to plan for a change if Congress doesn't act. Now, will Congress act? I think they might. There's an inflation bill that's just being proposed right now, basically component of the Build Back Better program that one senator basically just cut down. He's sort of reintroduced parts of it, and included in that, my understanding, is a way of extending some of these premium tax credits. But we'll see. We'll see. So how does this apply to you? If you currently are getting your health insurance through healthcare.gov, so you or a family member, something like that, you're going to want to be aware that your income might have a greater influence on what your premiums are going to be starting next year, okay? If this impacts your budget, you go from, right now, if you're getting X amount in premium tax credits, know that you might get a lesser amount starting next year and would need to pay more for your health insurance. Work with your certified financial planner, but at least be aware of that. To me, even though you might not be able to change it, that would be important to know so that you can plan accordingly, especially as prices everywhere else are going up. Next, I would then work with your certified financial planner. Are there any adjustments that we could make to our tax planning that if the current rules aren't extended, are there ways that we can have our income be even lower? And you might think, well, how can I do that? Well, depending on your situation, where you draw money from, whether you sell something that has capital gain, maybe you sell something that has a capital loss. Should you fund an HSA? Should you fund an IRA? Something like that. Should you change some of your financial behavior in order so that your tax return might have a lower amount of income and therefore allow you to maybe lessen the blow of some of these tax credits going away? And then third, if you're not currently on healthcare.gov, Affordable Care Act insurance, but you might be next year, you may plan to be next year. And who am I talking to? Those of you early retirees looking at retiring this year or later this year or next year, but not yet going to be eligible for Medicare, 65. You're going to want to be aware of this, that the rules are potentially changing. So as you're working with your certified financial planner who's doing comprehensive financial planning with you, taking a look at what you might be paying so that you can budget appropriately, plan for cash flow, whether you're going to draw Social Security, all those sorts of things, you're going to want to be aware that, hey, the premiums might be going up, and therefore what would the cost be under the current law, and what would the cost be if they extend the current benefits? So if you're not currently on the healthcare.gov insurance, but plan to be soon. Mostly you retirees, maybe if you own a business or thinking of stepping away from your steady job that has benefits and going out on your own because you've been doing a side hustle for a while, whatever, and you're going to use Affordable Care Act, healthcare.gov as your insurance provider, maybe that is now is a time for you to start planning ahead, doing some tax planning, working with your certified financial planner. Most CFPs, I'm just going to tell you, they're going to avoid talking about this because they're not doing comprehensive financial planning, working with a health insurance agent and your tax advisor to plan appropriately for this decision and how it impacts your overall financial plan. You need a CFP that's doing comprehensive financial planning. If you don't have one and need some assistance, you can contact one on my team. Find us online, Korhorn.com. That's Korhorn with K, wisemoneyshow.com. You can find us there as well, or give us a call, 574-247-5898. All right, there you have it. Go out and take your next wise step in your financial life.